One of the reasons I brought up Daniel Jones, besides the whole Jets Giants thing and everything else, but it's my concern is the neck injuries, and we talked about it briefly before we hit record on the show. He's had a few neck injuries. He's had at different times. So, I think going back to 2019, he suffered an injury, and then last year before he got hurt, he had a neck injury. And then he hurt it again. They said it was unrelated. So I am concerned, not so much from the knee aspect, and maybe you as a surgeon going, I'm concerned about the knee, but I'm also concerned about the neck injury.
Yeah.
And, I'm showing here for those that are listening and not watching us on YouTube, Packers running back A.J. Dillon, which is their star running back. He's on the season ending IR. He's done for the 2024 season with a stinger injury. And stinger is always kind of like, it's always a funny thing because I go, well, that doesn't sound like a big deal. It sounds like you got like a little pinch something or other, and you're going to be fine in a week or two. But apparently it is. Can you talk about, what kind of injury that is? And it's that's serious enough that without taking a snap in the 2024 season, getting hurt at a joint practice, that you are already done for the year.
So let's go through this. So first, I'll talk about the Dan Jones thing. So anytime the word is repetitive neck injury, I get worried.
Yeah.
And what the heck puts you out for a couple months? It's probably something cervical, which is in the neck, and it's probably in the disc. And he could be getting some bulges, and they're concerned about it, and maybe it's pinching a nerve. I don't really know. And they were super cryptic about it. I mean, he said he had a neck injury, but he's had this repeatedly 3 or 4 times.
Yeah.
Like, that's not a neck spasm. That's something where they're worried about the health of him, and if he gets another hit, could he like get paralyzed type of thing?
Yeah.
In my opinion.
Oh God. Yeah.
I don't think it's that bad, but I think that there's something else going on they're not telling us, and that's okay. That's the nature of football, and the nature of the show is we get to do a little guessing.
Yeah.
With the stinger, so usually a stinger is when you get hit on one side, it's unilateral, so one side. You get hit on the side, and it goes into your brachial plexus. So you imagine, I'm not going to get too much in anatomy, but imagine, we can try to show here, but imagine you have your neck and all the nerves come off and they go into like your upper chest area down to the shoulder, and they branch off like this. And when you stretch them, you get your whole arm just like you feel like a sting. Like, that's what I call it, a stinger.
Yeah.
Okay. And that's like, remember you guys ever hit your funny bone?
Yeah.
Imagine the whole arm.
Nothing.
The whole arm is where it happens. It happens and it goes away, right? And it's usually a single, like unilateral. We say you get a unilateral stinger, you're good. Like 10 minutes, rest, make sure they're all normal, and then they go. So that's what I don't understand about this. I think that they're trying to dumb down the injury. You get a bilateral stinger, that's when you basically likely had some real bad neck injury, like you're like a disc in your cervical spine, which we've talked about with Dr. Schaefer before on this show.
Yeah.
And that does concern me because I don't even know if that's considered a real stinger, right? Like, I think they're just doing, they say like knee contusion or knee sprain or meniscus contusion because they're trying to dumb it down. And what they're trying to do is trying to play it off as not that big a deal. But the fact is, if you're out for the season with this, that is not good. So I think, I don't know what he had. I'm surprised he's not getting surgery when he goes out like that. But there are some notable neck injuries that have happened in the NFL. Obviously, the most prominent one is Peyton Manning. He had multiple neck surgeries. He had a spinal fusion